think so.
Let me check. He's here.
Let's try to.
Yeah.
Ecco, ok.
Ah, ok, possono stare sciolti per ora.
Hello, everybody, and welcome to this talk with Professor Khera. I'm really pleased to say welcome to Professor Khera on behalf of the University Guglielmo Marconi. Before to introduce you, Reetika, I will just leave the floor to Michela Materazzo, head of the Department of Economic and Business Sciences, that is promoting the seminar. And Michela Materazzo is also Professor of International Marketing and Management. And then Francesco Gaspari, Delegate of Director for International Relations and Professor of Administrative Law, for a few welcome remarks. Over to you, Michela.
So, I'm very delighted to introduce this precious guest lecture on a very interesting topic at the intersection between digital transformation, digital technologies, and sustainability. And in particular, our department is particularly sensitive to this kind of topics because either from a research point of view and or from a teaching point of view, because we have a degree on in economics and management for innovation and sustainability. So our students are for sure very interested in sharing insights on this topic and on India in particular, because India is a country, a very significant case in point in relation to, because it is witnessed in over the last decades a dramatic growth in digital technologies, and now is implementing the use of this digital technology to support the welfare programs, and so to improve lives and social conditions and economic and conditions of Indian people. And so it will be really interesting for us to understand, to learn from India eventually, and also trying to understand if we can replicate this experience also in other contexts, for example, European and Western countries, if they can apply this kind of models. So I don't want to steal time to this precious guest lecture, and I hand over the floor to the internationalization referent of Marconi University, Professor Gaspari.
Yeah, just a few words. Once again, welcome to Professor Khera from India. It's a very important occasion to discuss about a topic actually that is an horizontal, which has an horizontal interest about all our departments. So the university itself, business, the Department of Business, which is promoting this event, but actually the university overall. We already had the occasion to speak about possible collaboration also in the future about our university, about digitalization. We have I take also the chance to remember that we have an important venue, which is the observatory on, on artificial intelligence here in our university, and I think this might be also an occasion to promote further collaborations between our university. And this topic is a very interesting topic. It's about the digitalization of welfare in India. So I think we have the opportunity to learn much today about this experience, and maybe we can replicate, as Michela said before, this experience also to get some insight for our students. So thank you once again, and enjoy the lecture to everybody. Thank you.
Thank you very much, Francesco and Michela, for these welcome remarks. Much has been said, so I just wanted to introduce Professor Reetika Khera. For those who don't know, he's a development economist based on the Indian Institute of Technology, Delhi. Professor Khera got her PhD at Delhi School of Economics and did a postdoc at Princeton. Apart from the Institute of Technology in Delhi, she taught at the Indian Institute of Management, Ahmedabad. She's, and that's for me very, very inspiring. She interested in research for action and has been closely involved with people's movement for social economic rights in India. And given the case that you are referring to in your seminar, and the implications and the inputs that all of this can also provide to us in Europe, especially in Italy, of income, welfare, support measures, and the way we provide these kind of intervention through digital technologies and other aspects that if I had time in the Q&A I would like to ask. This is of very much interest for us, and I'm sure for our students and for following the event online. Now over to you, Professor Khera. Thanks so much. The stage is yours.
So thank you everyone for making time and for joining either in person or online. It's a pleasure for me actually to be able to share some of the work that we have been doing. As Fabrizio already said, I'm trained as a development economist, and so my interest is actually in welfare programs. I was not particularly interested in technology per se, but about 15, 20 years ago, the Indian government decided to bring all kinds of digital innovations to the administration. And some of this was very basic. It was just basically computerizing records of people who are entitled to a benefit of one kind or another. But the one that I will talk about today in particular is something that started around 2009-10, and it was something called, wait, I think it's on the previous slide. Yeah, it's called Aadhaar. It's supposed to be a unique and digital ID. In India, we don't have a national ID card. And this was supposed to be something like a national ID card. The only thing is that in and of itself, having this Aadhaar card or number doesn't guarantee anything for a person who has it. It's actually something that you need to have so that you can continue to get what you were already getting from the state, whether it is subsidized food or old age pensions or whatever it is. In order to continue after 2010, when this started rolling out, the government said, now if you want to continue getting it, you must get this digital ID and you must link it with your existing benefits so that we don't remove you. And I'll explain why that was put in place. So the bulk of my talk, maybe I'll just talk about this particular initiative because, and I thought instead of trying to cover many studies, it is better to do like a detailed dive into one particular example. And these issues have arisen in other programs as well. And then the second part, which is perhaps of more interest to those who study technology and law, is related to the right to privacy and digital data. Yeah, so that we'll see. If there's time, then I'll talk about it. Otherwise, perhaps not. And then in the end, there are some. If there's time, maybe during the discussion we can talk a little bit about what does all this mean for economists and economics research per se. And then, of course, I'm talking about development economics, not everything in economics. So to start with, India has sort of nascent welfare state. There is something in place. The benefits are not very large. But one interesting thing in the developing country context is that these benefits are now legal entitlements. So there are laws through which people are guaranteed either employment when they're not able to get employment, this is for rural households, or in this case there is the National Food Security Act. That's what NFSA stands for, the National Food Security Act, which has 4 different programs. 2 are for children under 6. For children who go to schools, there are school meals that are provided free of cost. Then there is the program that I will talk about today, the public distribution system, which is a system through which each household that is that is covered by the program is entitled to 5 kilos every month per person of either wheat or rice. So it's a very basic kind of provision, but still this is quite important for poor people in India because it provides some kind of guarantee that they will not sleep hungry in that month. So this is the program that I will talk about because we did a big study. Now the way it works is in the Food Security Act, which was passed in 2013, the existing program of public distribution system, it became a legal entitlement. So it was always there. It's been there since the Second World War. But the program has expanded in coverage, and in 2013 it became a legal entitlement. And through the law, what was said is that 2/3 of the Indian population will be entitled to 5 kilos per person per month at a very nominal price. It's only 1 or 2 or 3 rupees per kilo, which is like 1 or 2 cents per kilo of wheat and rice. And the market price, of course, is close to 20 or 30 cents, I would say, roughly speaking. So it is a big subsidy. It's not a small subsidy per kilo. It's a substantial subsidy, even though giving just wheat and rice, we feel, is not enough. It should be more nutritious food as well. Anyway, we'll go there later. So, like I said, this program has existed for a very long time. It was put in place during the Second World War by the British, because at that time, during the war, there were shortages. And in urban areas, they brought the rationing system. And this is something I think even European countries have had, which is during the wars, there were rations. And people got tokens, and because there was a short supply of some basic essentials. So it's basically the same thing that was introduced in Indian cities at that time. And in the initial 20 odd years, this was very much an urban program. So it was mainly in the urban areas. But later, because this urban bias in the program was documented, it began to be expanded in rural areas. And today, actually, 75% of the rural population and 50% of the urban population, according to the Food Security Act, is supposed to be covered by the public distribution system. Now, in this program, one old problem has been that people don't get what they're supposed to get because there is a lot of cheating and corruption. So because the people who go to these shops, they are poor people, they are not very empowered people. When they go to the shop, suppose Francesco comes to me and I'm the shopkeeper, I will force him to sign for 5 kilos, saying that he has got his 5 kilos, but in fact, I only give him 1. And because there is nobody to complain to, and because he is not empowered, either he takes it or he just goes. So this was a big problem. Until 2011-12, about 50% of the grain that was being supplied through the public distribution system was not reaching people. It was being siphoned off from the system. And so this has been a big battle in the Indian case, is how to deal with corruption in these welfare programs. And that's when the Aadhaar, the digital ID, entered the picture. They said that the PDS, the public distribution system, has a lot of leakages. And in their view, the idea was that it is because there are someone like, say, Francesco, he doesn't have one card. Instead of having only one card, he actually managed to get 10 because he has friends in powerful places. And so they say if we bring a biometric, digital, deduplicated, unique ID, then we'll be able to take out all the extra fake ration cards from the system, and it will reduce corruption in the system. So that was the thinking behind it, and I'll explain what the ground situation is like. And that's when we decided, so the Aadhaar program, the digital ID, began to be issued from 2010 onwards, but the integration with the public distribution system only began in 2015-16. And by 2017, they had actually made it compulsory in the program. Now, before we go ahead, maybe it's good to understand how all the different ways in which corruption in the PDS happens. So this is a typology of the different kinds of corruption in the PDS. I don't know, is this the pointer? Yes. Yeah, so I don't know if... the pointer works only on... Yeah, it's fine then. Doesn't matter. So the first one is identity fraud. That's a little bit like what I was talking about, that I'm entitled only to one ration card, but I managed to get more than one, so that's duplication. That's fine, thank you. Then there's another similar problem, which is that even though I may be dead, my ration card continues. It's being used by my family members, and my name is not removed. So that's what we called a ghost. Someone whose name is running in the system, whose benefits are being sent by the government, and in fact somebody is claiming them, but that somebody is dead and gone, and nobody had the time to update the administrative records and remove this dead person. So those are the two main kinds of identity fraud in the public distribution system. The second is quantity fraud that I already explained, that if somebody comes to me, I'm the seller, I make that person sign for 5 kilos, but I in fact only give them 1 kilo or whatever I feel like. Yeah, so that's when you are cheated on the quantity. That's called underselling. The other thing is, 1 month I may give you your grain, the other month I don't give it to you, but the month that I give it to you, I make you sign even for the months that I didn't give it to you. That's quantity fraud. Third type is eligibility fraud, which is that, like I said, it's not a universal system. Only 2/3 of the population is entitled. And so the governments have a list of eligibility criteria, okay? And so they'll say that if you have a government job, clearly you're not poor, and so you're not supposed to get it. But in a rural area, somebody in the family may have a small government job, but because of that, they're very well connected. And so they manage to get a ration card even though they're not entitled. So that's eligibility fraud. You're not eligible, but you manage to establish yourself as an eligible person. The fourth is overcharging. I'm supposed to charge you 1 rupee, but I charge you 10 rupees. And again, there's no one to complain to, and 10 rupees is still less than the market price, which is 20 rupees. So you say, okay, fine, I'll pay 10 rupees, even though I'm supposed to pay only 1. And that's another kind of cheating in the public distribution system. And then the last one, which has become very uncommon now, or it's less common now, is quality of grain. So what they would do is, if they get a sack of 100 or 50 kilos of wheat or rice, they mix 1 or 2 or 5 kilos of something. And so basically they end up saving 1 or 2 or 5 kilos. Yeah, so the quality of the grain may be adulterated in this manner. Now, if you see this whole typology of fraud, in fact, where can a technology such as the digital ID, the biometric digital ID help? It can only help in the first category of fraud, right? Because if it is indeed deduplicated, it is unique, then you can say that, okay, everyone who has a ration card has to link it with their unique ID, and then any ration card without an ID linked to it must be a duplicate or a ghost, right? Because the person is dead, there is no Aadhaar number or card, and so nobody has been able to link it, and then you can investigate and remove those names. But for all the other categories of fraud that I talked about and explained, something like Aadhaar, the digital ID, can't really be helpful. But they thought that even for quantity fraud, it might be helpful, because they thought, okay, now what we'll do is when somebody comes to buy grain from me, they will not simply sign in a register. What they have to do is they have to bring their Aadhaar ID, and then in the machine, they have to biometrically authenticate themselves. And if the fingerprint at the time of buying your grain in a particular month matches your fingerprint when you enrolled, then it will say, yes, this is Francesco, or yes, this is Michela, and you will get your grain. But that doesn't stop quantity fraud, right? If I could force you to sign for 5 kilos and give you only 1 kilo, I can force you to put your fingerprint for 5 kilos, and I still give you only 1 kilo. So we were trying to explain to the government that actually, even if the technology works really well, in principle, in theory, for all these different categories of fraud, you will only be able to deal with one category. And according to the documentation and research we had until then, first of all, there was no quantification of identity fraud. There was quite a lot of quantification of quantity fraud, but no one had studied identity fraud. And to the extent that there was a little bit of evidence, it was 1 or 2%. They said 1 or 2% of the cards were found to be either ghosts or duplicates. So we said that actually this is not the main problem. But anyway, the government, as they often do, they don't necessarily listen. And they went ahead and implemented it. So now, how is this supposed to work? Let's try and understand how this whole thing has to be. The whole system had to be rejigged to be compliant with this digital ID that we call Aadhaar. So ABBA stands not for the music group ABBA, but for Aadhaar-based biometric authentication. Okay, but it's useful. You'll remember it hopefully because of that. Now, what you have to do first of all is if you are an entitled family and you have the ration card, after 2016, you had to get your Aadhaar, take it to your local dealer or to the local food officer, and ensure that in the PDS database, in the database of ration cards, in a new column, your Aadhaar numbers are also entered. Okay, that is called Aadhaar seeding. The database has to be seeded with Aadhaar numbers. That was step number 1. Step number 2 was that now that you have done your seeding, that is supposed to be a one-off thing. You do it once and then that's it, it's done. But every month that you go to buy your rations, at the time of buying your grain, you have to, there is a POS machine, a point of sale machine, which is like, a debit card machine or whatever, credit card machine, where you have to put, first of all, you have to enter the ration card number. That will go to the food server. The food server will say, yes, this ration card is supposed to get 5 or 10 or 20 kilos of grain. That message comes down. Then you have to put your Aadhaar number and you have to put your fingerprint. Then that goes to the Aadhaar server, and then the Aadhaar server matches the Aadhaar number with the corresponding fingerprint. And then it says, yes, this matches, and then you can receive your grain, okay? So at the precise moment that you go to buy your grain on any particular month, everything has to be in place. The food server should not be down. The Aadhaar server should not be down. Your fingerprint today has to match your fingerprint, whatever, 4 years, 10 years ago when you enrolled into the Aadhaar system. And in fact, what we found is that a lot of this doesn't really work. Yeah, so connectivity may be an issue, electricity may be an issue, server downtime may be an issue. And then, of course, for many poor people in India who do manual work, their fingerprints, they change over time. Already even I have actually, I don't do manual work, but even when I go for my visa applications and I have to give my fingerprints, the fingerprint quality is never good enough and I have to do it again and again. And then, so many people have fingerprint issues, and especially in old age, fingerprints are not very reliable, and the matching, so basically you have to keep updating your fingerprints to make it work. So there are many vulnerabilities in this technology, and that's why we say these are fragile technologies, especially in the rural context. So here, so what I've done actually is I've mixed up some of the quantitative findings from the primary survey that we did, and I'll talk about that. But I also have a few case studies to make it come alive, like to explain the issue. So this is one person we met during our survey, and like I said, this is the first step. At the first step, which is Aadhaar seeding. Now, to do Aadhaar seeding, you need to have Aadhaar. Now, unfortunately, this lady, she was not able to enroll for Aadhaar. She was a widow. She's a widow living alone. And she had stopped. Our survey happened in May 2017. And for 6 months, by the time we met her, she had not got her entitlement. And why was that? It's because she had not been able to enroll into the Aadhaar system. She made multiple trips to the local office, but somehow nobody was able to give her a straight reply. And then what happens is, then you stop getting your grain if you don't comply. Another very terrible case, and this is not the only case, is that this family, they had Aadhaar numbers, but when they were trying to do the seeding, somehow it was not working. Somebody was possibly even asking for a bribe to do the seeding. And in the state of Jharkhand, where our survey happened and where this young girl lived, the state government on July 31st, 2017, they said, you have been given 3 months, 6 months to do your Aadhaar seeding, and July 31st is the deadline. After July 31st, any ration card without an Aadhaar number is automatically declared a ghost or a duplicate and is deleted from the system. So this family, they were not able to do the seeding, and their ration card was deleted. They stopped getting their grain. And in September, end of September, this young girl who was only 11 years old, she was at home and she passed away in her mother's arms, and she was saying rice, rice, because she was hungry. So apparently it was a starvation death. And this family also happened to belong to a scheduled caste, which is one of the most vulnerable social groups in India. And basically she died. And it was a very clear kind of link between the way this was implemented in that particular state. Another terrible case is where this family, they have Aadhaar, they were able to do the seeding, but when they went to buy at the ration shop, their fingerprints were not working. And actually there is one safeguard. Suppose the 3 of us are of the same family, any one of us can go and put our fingerprint. It doesn't have to be only Michaela or me. It can be any 3. So in fact, a lot of people were trying to do this, figure out whose fingerprints work. And in this unfortunate case, actually the fingerprints for both people, they were just the father and daughter, I think, living together. And their fingerprints didn't work for either of the two. They stopped getting their rations. They were already quite poor and vulnerable. And the older man, he ended up dying in October 2017. So this is just to show that actually, in fact, these vulnerabilities that I was talking about, it's not just in theory. This was actually happening on the ground, and as extreme as people losing their lives because of the way the government said, no, you do everything or you don't get anything, right? There was no flexibility in the system at that time. So we had been hearing about these kinds of difficulties, and in May 2017, we decided to do a proper survey with good sampling, etc. And so in this particular eastern state of India, which is amongst the poorest states in the country where this had been made compulsory, we decided to do a survey in 8 districts. In each district, we went to a sub-district, 2 sub-districts. So because there are 8 districts and 2 per district, we had 16 blocks. And in each block, we went to 2 villages, so 32 villages. All this was through random sampling. And then in each village, we went to 20 households that had bought grain in the previous month, and 20 households who had not been able to buy grain in the previous month. So transacting household means a household who actually went and bought their grain, and non-transacting household means households that were supposed to, who are on the list of entitled households, but they were not able to buy in the previous month. So overall, our sample size was 890 households covering 32 villages of 1 state in the country. And in the sample, we had villages that were completely online, which had all this full technology in place. We had some offline villages who had not yet been onboarded. And then there were other villages which were kind of, juggling between the two because people were facing difficulties, so they were still on the old system. And so in the online villages, as you can see, everything was supposed to be in place. Aadhaar seeding, ABBA, or Aadhaar-based biometric authentication. It had to be real-time online, and the monthly transaction data is uploaded. In the offline villages, only some parts of this entire chain was implemented, not the whole thing. And in the other villages, they were completely offline in the old system. So all paper-based, right? So we were able to study the impact of the introduction of this new technology. And what did we find? We found that in the villages that were online, which had every single component of the new technology in place, transaction failure rates were 5 times as high than the offline villages. So many more people were not able to buy their entitlement because of something going wrong in that chain. The other thing so one possibility, sometimes people say, well, maybe those people are not interested in buying, right? A non-transacting household doesn't necessarily mean that the technology has failed. Maybe in that particular month, they say, I don't need this benefit from the government, I forgo it. So amongst the non-transacting household, we also asked them what was the reason for not buying. And amongst the ones who are saying that they are not interested in the PDS is basically just 1%. Yeah, so actually most people are interested in buying this entitlement. And you can see that the reasons they gave for non-transactions is that the system did not work. There was no member in the household whose fingerprint was working, or the Aadhaar integration had not been done. Now, non-transacting households, again, this is to help understand exactly how vulnerable these people are. One of them was this old lady, Olasi Hansda, and you can see just from, she can't walk basically. She's so old that she's no longer, she can only sit like this. And earlier, somebody in the family could go and bring the grain for her because all they needed was, or a neighbor could go and bring her entitlement for her. But now it has to be her, and it has to be her fingerprint. And if she's immobile, then she cannot go to the ration shop to be able to complete this transaction. And so what had happened is that for 5 months, she had not been able to get what she was entitled to. Now, I've been talking a lot about the pain from the system, right? That there is a lot of pain, people are getting knocked out, they're not able to buy their grain. One may say that, okay, maybe the pain is worth it. There may be some gain as well. Yes, there is pain, but has the system improved overall? Like I said, the whole point was to reduce corruption in the system. And if there is a big benefit from implementing, then you could say, okay, well, you know, some people for some time, they have to experience pain, but the benefits, the gains from it outweigh the pain. But in fact, in our survey, we found that there is no gain from the implementation of this particular system. And how do we do that? We compare households that are in the online villages with all the technology in place with the households that are in the old system or only partially integrated in the new system. And the other thing we do is we compare before the technology was introduced and after the technology was introduced to see if there is any difference in the corruption. How do we calculate corruption? It's a very simple measure. It's called the purchase entitlement ratio, which is if I'm entitled to 5 kilos, how much did I actually get in the previous month? If I get 5 kilos, then there is no corruption. Purchase entitlement ratio will be 100%. If there is a lot of corruption, then the purchase entitlement ratio is very small. And what you find in this simple chart is that the corruption in the online and the offline villages, there is no difference. People are getting 93 or 94% of their entitlement. And before and after, compare the red with the black, before and after also, there is no difference. So in the online villages, before also they were getting 93%, and after the introduction of this new system, it's exactly the same. And in the offline villages, again, there's no difference because, of course, they haven't been integrated entirely. But there is no difference between the offline villages and the online villages. So there was very little evidence of improvement, of gain from the system. And that's why actually this paper is called Pain Without Gain. And by the way, I should have mentioned earlier that this is joint work with 3 other co-authors. It was written on one of the slides, but I forgot to mention it. Now, am I doing okay for time? Yeah? Okay. So now going further, this is actually now going back about the pain. This is going back to the pain question. In terms of people who are transacting, has their experience improved? Right? You may be successful, but maybe you know, now it's easier than before. But in fact, what we find is that the average time taken in the online villages with the new technology is higher than the average time taken in the old style. Yeah. So in the old register paper-based system, people were spending 57 minutes, so about an hour, coming and going, queuing up, etc. But amongst the online villages, it was 1 hour and 40 minutes. Yeah, so much more. Another way of looking at this, of course, this is the proportion of households who have experienced issues when they went to the shop, right? So what happens typically is you go there, and then you queue up, and then suppose I'm first in the queue, and I go there, and then he says, oh, there's no signal. So you have to wait. Then he says, okay, let me go from here to there, you know, because maybe the signal, you know, I think this happens in Italy also, you know, you have to go to a better place. So then you say, yes. in India, they say tower, the signal tower is coming. So they go there. So basically all of this adds to the time. Then first time you put your fingerprint, it may not work. Then he says, do like this, put some water, make it a bit more moist, and then sometimes it may work. So because of all these issues, people are having to spend more time, even when they're successful. So there are a whole range of issues that they get. They get error messages, biometric failure, machine is not working, etc., etc. On the other hand, so if you don't look at it from the point of view of the beneficiaries, the entitled households, if you look at it from the point of view of the seller, also things have not improved. So earlier, they were spending 3 to 4 days on making all their sales for the month, right? So the number of days they have to spend in giving everyone their entitlement used to be 3 or 4 days. Now, after the introduction of this new system, the red bars, the number of days have gone up, right? So on the one hand, people were suffering either because they were not getting it or because they had to spend more time getting it. And on the other hand, the dealers also, the salesperson, they are also kind of stuck because now for 10 extra days, they have to sit at the shop because waiting for the signal to come, etc. So unfortunately, I think perhaps contrary to what you might have expected, I mean, of course, there are many good examples, and I'll talk about some of the good examples as well. In this particular case, it was not a very sensible kind of technology to introduce for this kind of measure, which is supposed to be a food security measure, and it ended up undermining people's food security to the extent that some of them died even. On the other hand, of course, internationally, if you read the literature on Aadhaar, on this digital ID, you will see a lot of praise for it. It is being marketed not just by the Indian government, but also by entities such as the World Bank, etc., as a very successful initiative that has led to a lot of savings in welfare spending. But in fact, what is counted as a saving is actually knocking out eligible people, people who are alive, and removing their names, not giving them their entitlements. So exclusion is being passed off as savings in some of this international literature. Now, another sad part of this story is that indeed, actually a lot of my old work was on documenting the corruption in the PDS. That is what I was interested in. And therefore I started paying attention to this digital ID because I thought, here's something that can help. Because we were feeling very bad that this system, which could do such good things, was actually not because of the corruption. And in fact, what we had found is that in the PDS, corruption levels had started going down before Aadhaar entered the picture. And so these are estimates from my earlier work on the corruption in the system. Like I said, it was terrible. This is from 2006, 7, 7, 8, 11, 12, so going up to 2017. These are estimates of leakage, and there was a time when only 20% of what was supposed to go to people was actually going to them. But already by 2011-12, the situation had started turning around, and leakage rates fell from 56% to 29%, and even further, by 2017, they were down even more. So in fact, there were already other remedies for dealing with corruption, including digitization. Like I said, the digitization, computerization of records was a big help in bringing corruption levels down. But in fact, the introduction of this new technology, which was not appropriate for the rural context, ended up undermining some of these improvements that we had been seeing. So basically, this part is to show that, there are technologies and there are technologies. Like computerization was great and has been very helpful in improving administrative capacity and implementing government programs more efficiently. But then there are technologies such as biometrics and server connectivity, etc., which can actually be quite detrimental to people's interests. And that's one important thing to bear in mind, that not everything digital is automatically good. I mean, it's a very self-evident kind of thing, but somehow I think we always forget that, there might be an other side to this story. So, like I said, this is just one sort of detailed study of the detrimental effects of some of these digital technologies. But there are other examples. Unfortunately, there are some other examples also where they have caused as much harm, if not more harm, than the gains from implementation. And there are many good examples, but they are more fundamental, like, digitizing and putting in place a management information system that has been very good in the procurement of grain. The government of India procures grain from farmers, and they have been able to use an MIS-based system to track who is selling how much, who is paid how much, etc. And those have been quite good. In the Employment Guarantee Act, which is also a social security measure, the MIS has been very good. It has brought transparency. in the system so people can track what is being spent in their name. But also in administration, it has helped to streamline administration. It's a very big program. So 25% of the rural population participates in this employment program, and it would not be possible to implement without computerization, digitization. So so I think the main point from some of this work is that we must learn to distinguish between appropriate technology and not appropriate, and technology versus technocracy. And I think when it's technocracy is when it starts to get a little bit difficult and not in people's interest. The second part actually, and maybe I can go quite quickly through it, is sort of the thing that I was saying might be of interest to those who work with data mining, big data, etc., and those who have an interest in law. Now, this is a completely different paper from what I have been talking about, but I think it's interesting, so I thought let me try and squeeze in at least a few slides in a few minutes. Now, in the Indian, I think in European countries, right to privacy is taken very seriously. And I think it is partly I think it's partly because of that at least there was a genuine attempt to put the GDPR in place, the General Data Protection Rules in place. So this is sort of in that realm. What is happening in India? Yeah. So in the Indian case, because of this digital ID that I was talking about, some of us, not me particularly, but I was sort of in the group in a wider sense, went to the Supreme Court of India, and they said that the Aadhaar, the digital ID, is actually violating the right to privacy, and that the right to privacy is a fundamental right in India. Now, I'm going to cut a very long story short, but the Indian government, believe it or not, at that time, actually went to court and said that this is not a settled question, whether the right to privacy is a fundamental right. It was mainly basically to delay the matter. And indeed, they were successful in doing it because they wanted to delay it so that the Aadhaar program would become too big to fail. I mean, if everyone has got an Aadhaar and you've started integrating with every single program in the country, then even if the Supreme Court later on says that this violates the right to privacy, you may not be able to go back. And indeed, that is what happened. Eventually, the Supreme Court of India, they ruled that it is a fundamental right. But they managed to also find a way of saying, well, Aadhaar, it's not really violating the right to privacy. So they allowed Aadhaar to continue. Now, so this is coming because of my involvement with this kind of debate on the legal side. I got interested in these issues, and I can start with a very simple example of this very poor worker in a rural area in eastern India again. Many years ago, this is before Aadhaar entered the picture, it has nothing to do with Aadhaar, he worked on a government public works program. And when we met him, he had not been paid for 6 months. 6 months' wages were due to him. And we were pretty shocked, so we intervened. And because of our intervention, he was paid after some time. So when 1 or 2 months later, we went back to the same village, we asked him, did you get it? And he said yes. So then we were interested. We were like, what did you do with that money? Because it was quite a substantial sum. He said, I invested it. So we were very pleased to hear this. We were like, look, these people are so smart. Poor people are always treated quite badly and projected in a very terrible way. So we said, what did you invest it in? So he said, let me show you. He brought a piece of paper. And basically what had happened is somebody had found out that he was paid this huge sum. They showed up at his doorstep and they told him, why don't you invest in this? And they were just frauds. And they just gave him a piece of paper that looked a bit official, but actually they had vanished with his money. So for me, that was quite an important lesson in the right to privacy in a very simple kind of way. Somebody in the government local office had leaked information that this poor man is going to get 20,000 rupees, which is a lot of money, 10, 15, 20 years ago in the rural Indian context. And because that information leaked, he became prey to this fraud in this particular way. And the reason I think this is important is because when this right to privacy debate was going on in India, many elite people, many privileged people were trying to say that the right to privacy is actually only a concern of the rich and the privileged. It is not something that matters to poor people, that they don't understand privacy. But in fact, actually, it has a very real and present, it can pose a real and present danger to poor people as well. And I think this case about the worker who lost his savings or his earnings is quite an important illustration of that problem. Now, in economics, well, let's talk about data first. So there are now, because so much of our life is online, so many different things we do online that we used to not do. Like I used to only read newspapers, but I get most of my news on the phone now. So people know what I'm reading. Earlier, only the newspaper delivery guy knew which newspapers I read. But now somebody knows exactly what I'm interested in, what topics I'm interested in, because of cookies on the phone, etc. Right? Now, it's not just a question of that. There is public data and there's private data. In private data, there are things, very sensitive things, like mental health apps are becoming quite common now. There are menstruation tracking apps which will keep track of women's bodies. There are food deliveries. Do I always... So in India, this is a big thing. I think maybe it's not so much in the European context, but because labor is cheap in India, a lot of people, they order online food to be delivered at home. So what used to be home delivery is now through these apps. Now they know, Reetika is always ordering vegetarian or always ordering red meat. And so even that information can say something about my lifestyle and health, etc. And then, of course, there are things like Uber, where, if every night, I'm making a ride from my house to, not to the university, but to somebody else's house, then people might, that already gives some signal, like, at night she goes to that house and in the morning she comes back to her house, and that might be something to be suspicious of. Similarly, the government has a lot of data. It holds it in fiduciary capacity, but in the Indian case, there have been 1 or 2 instances of the government selling our data to private entities. And one example which they admitted to in the parliament is that vehicle registration data was sold by the government so if you have car insurance, those kinds of companies now have information on your cars, etc. And of course, the government has much more. And so the point that I'm trying to make in this paper, and I'll try to speed up because in the interest of time, is that a lot of our personal data is actually can compromise our privacy, right? So what I eat, healthy versus unhealthy, from the food apps, where I go, like I said, if I'm going to somebody's house every night and coming back in the morning, that can ring some alarm bells. What vehicles I own, what property I own, that also is a compromise of my financial privacy. What medicines I purchase. So now there are apps in India where you can order, your prescription is available to the pharmacy. And then that's also very sensitive information. Do I have blood pressure medication? Do I have diabetes? And then you can start making interlinkages. Ritik, if all of this data is going to get sold and somebody is going to integrate it, then they can say, oh, look, Reetika has diabetes, but she's always ordering sweets and desserts on her food app. And so that information can be misused by health insurance companies. We don't have a full-fledged health system to say, oh, look, she's diabetic and she's so careless about her diet, so maybe we should not give her health insurance, or we should charge her a very high premium, right? So these are the ways in which, one, our privacy is compromised by our personal data, and 2, it can be used against us in ways that... Now, in economics, people will say, hey, this is just a missing market problem. Suddenly, there's a rise of these digital technologies. And actually, there's so much interesting stuff we can learn from data mining, big data. There are data lakes, and we can integrate all of this. And, there will be amazing new insights into medicine or whatever it is. And indeed, that is the case to some extent. But what we don't talk about is the kind of underbelly of these rising digitalization of our lives, of our personal lives, and the kinds of harms that it can do. And I think the point that I wanted to make in this paper is that some economic philosophers have actually thought about some of these issues. And the most interesting, I've listed a few of them here, but the most interesting one is Deborah Satz, who says that some markets are noxious markets. And she says these are the characteristics of noxious markets. There is vulnerability, that you enter into a transaction because you don't have the ability to push back. You have weak agency. It leads, when this transaction in the market leads to harmful outcomes for individuals. One example is online gambling. Or it leads to harmful outcomes for society as a whole, right? So if, so the example that I've given is when they undermine an equal society or support relations of humiliating subordination or unaccountable power. And I feel that these digital, if we allow a market for personal data, it's basically allowing for us to trade our right to privacy in exchange for something. And in fact, then that meets all the criteria of a noxious market. And these are just a few examples to illustrate how some of these digital technologies are either leading to bad outcomes for us or for society, or these are transactions based on vulnerabilities and weak agency. And so Deborah Satz, who has written about noxious markets, she says that when markets are noxious, what are the options available to us? And she says that there are, in fact, many alternatives. Either you find other ways of creating distribution, you find ways of redistributing the gains, or you regulate. So GDPR is a way of regulating. And in fact, in certain cases, it's even blocking, right? Certain kinds of data are not supposed to be traded. So there's a whole range of options available to us. And in the European case, I saw you shaking your head, and I kind of agree a little bit that basically with what has happened after GDPR in Europe is that the big tech giants like Google or whatever, if they are found violating GDPR, they get these big fines, right? I think there has been at least 1 or 2 cases in France where there were huge fines were imposed on them. But in fact, if you look more carefully, what you find is it's not even 1% of their revenue, right? So what these companies seem to be saying is that we should just treat these fines as operational costs. If we get fined, we pay. And we just move on. It's a little bit like traveling in the bus in Rome. You may not buy a ticket, and if you get caught, you pay the fine, and then otherwise you just continue as before. Yeah, so there's a little bit of that going on. Even then, I think the GDPR is a much better law and much better provides much better protection than the Indian law, which came very late and is quite weak, and actually is geared much more to creating an enabling framework for companies to do data mining. It's not creating a framework to protect. Yeah, that's not the main focus of the Indian law. And that's quite worrying in the Indian case, where people we don't have 100% literacy. We don't have financial literacy. We have poor financial literacy. We have very poor digital literacy. Just the most recent data that is available from India, it's an all India survey. They find that 17% of rural Indian women are able to do online banking transactions, right? So it's still very small. And then, of course, there are great disparities, right? If you are an indigenous person in a rural area, you're even less likely to be able to cope with this world. So both examples are basically sort of a caution to think more critically and to be cognizant of the contextual factors when we are so excited also about, obviously these technologies work very well for me, so it's, but it may not necessarily work, so they can be a force of increasing inequalities as well, and this is something other people have talked about as well. So I think I'll stop with that. Thank you. Thank you.
Thank you very much, Reetika, for your very inspiring speech. There are many inputs that also, that even if you focused on specific Indian cases with country-specific features. I think there are implications. There are many implications also for us. I mean, for European countries and particularly for Italy. If you want, if any of you have questions for Reetika, I will take advantage of my position while you think about it of moderators to ask your perspective of a couple of issues that are of my research interest. So as you know, I'm interested in the issues related to financial inclusion, exclusion, and there are a couple of tools aspects that are that for which India is a very, very interesting case, and starting from one aspect, as you said before, it's well documented the positive vision that most international organizations had and documented in their reports on the experimentation of this ID, of this digital ID. Was always this recall in I remember in the World Bank Findex reports with the country profile of India. It was highlighted the remarkable result of having more than doubled the share of account ownership in that 10 years, 2011 to 2021. That was a remarkable result for observers like us on the issue, and one of the reason was a specific government program for the unbanked, leveraged on this digital ID. I'm very curious of your perspective, of your vision on that. Let me add something that is different field, but same. They are intertwined, interconnected. The two of my comments. CBDCs, central bank digital currencies, as this currency managed by the state as a response to stable coins, so private initiative, cryptocurrencies, and all like that. So it's really interesting. I'm following the literature and trying to write something on that. But of course, India with its remarkable share of individuals that switch from cash-based transactions to digital payments is a really interesting case, and also for other reasons. But I'm interested in CBDCs also because it is assumed that there's not only an objective of maintaining the control of monetary policy, but not that marginal objective is to promote financial inclusion through CBDCs. One example, I can directly channel welfare support measures to recipients, bypassing all the intermediaries where maybe corruption can occur or inefficiencies may happen. This is given the fact that we are speaking about I'm mentioning a very young instrument. There are few experimentation and very, very few implementation of central bank digital currency, so we really don't know how this is going to work. But I don't know, what do you expect? What do you see in this? Because there's a promotion of this kind of, using digital ID, digital currencies, and in a way identify recipients of welfare measures through a digital something, as there's a promise on this. And what do you think about that? Thank you.
Okay. So, so a lot of things, some of which I don't really work on. So can I take this opportunity to invite you to come and do some research in India on these issues? Because I think one big problem is that we don't have good research. I think, or not enough good research. We have some good research, obviously, but just completely independent and dispassionately looking at these issues, it's becoming harder and harder. And I can talk a little bit about that separately. But to go back to the specific issue, now you're absolutely right that there's been a huge increase in the number of bank accounts in the country, which is automatically counted as financial inclusion. But in fact, financial inclusion should be and is much more. Fine. First step, but it's an important first step. Yeah, yeah, yeah.
In our view.
Absolutely. But even having a bank account could mean a lot for poor people, even if it is, a very basic account where they're not allowed credit, etc. It's still something. To some extent, it was enabled by Aadhaar, by this digital ID. To some extent, in fact, it was already happening before, but it was projected as an achievement of Aadhaar. To the extent that it happened because of Aadhaar, actually we are currently paying the price for it now. Because, now this is a big story, but again I'll try to be brief. When Aadhaar was rolled out, the way they thought they could reach, we're a very big population, right? And they wanted to get everyone in. So how did they do it? It was not done by government directly. They subcontracted. And they said, if you will get money per enrollment. So those who got the contract, they went to the village, they set up a camp, and their interest was in getting as many people in as little time as possible, because they were getting per person reimbursement or money. They didn't care about the quality, right? So my name is spelled Reetika. They would put Ritika, right? My date of birth, I don't really have my birth, because a lot of people didn't have birth certificates. They say, okay, they found a few villages where everyone's birth date was 1st January 1910, right? So they basically found shortcuts to do the enrollment. Now, initially, it didn't matter much because, okay, it's your biometrics, it's kind of your name, it doesn't matter. But when you start integrating it with the banking system, it begins to matter a lot. Because in the banking system, I'm Reetika space Khera, but in the Aadhaar database, I'm Reetika space Ritik Khera. That one extra space means that when you do the seeding, it will fail because the computer doesn't care. 2 spaces is different from 1 space, and it fails to do the linking, right? And I have actually currently some colleagues of mine have been doing this documentation. What has happened is that a lot of people whose accounts were opened through this ID are now finding that they're locked out of their accounts. And it's happening on a pretty large scale still. So there is quite there's a big story in the underbelly as well, even though there are some achievements. I'm not denying that there are achievements, but it has come at a cost, which is being paid by poor people by being locked out of their bank accounts as well. That's one. It's a partial answer, but like I said, this is something that needs to be investigated more systematically and on a bigger scale. The second thing that you mentioned, which I can provide a partial answer to, I don't work on these digital currencies, etc., but there is one aspect which we were told in 2009-10 when Aadhaar came, is that if we give money directly, we give Aadhaar, we open bank accounts using Aadhaar, and then we put money in people's bank accounts. And we get rid of all the corruption in between. It sounded great. But in fact, Aadhaar has created its own machinery of middlemen who are very corrupt. Because when you have an error in your demographic data in your Aadhaar database, what do? You have to go somewhere and you have to have it corrected. So they charge you money for it. The official rate is 50 rupees, they charge you 100 rupees, right? So there's a whole range of ways in which Aadhaar has created its own machinery of financial intermediaries whose job it is to help. And of course, these people are not government employees. There is very poor accountability. So some of them are also cheating people. Like, when they go to withdraw money from these banking correspondents, she says, I want 1,000 rupees, and they put 2,000 rupees, and they say, oh, your fingerprint failed. So they make her do it 2 or 3 times, but actually it didn't fail. It was successful. And so instead of withdrawing 1, they make her withdraw 2, and they don't even tell her that we are keeping the remaining money, right? So I think the problem is really that the foundation is weak, right? You need people to be aware of their rights. You need them to be able to read and write. You need to be able to create a banking system which is like the banking system that I use, where there is some integrity, not a second-rate system for the poor people where, somehow they don't get passbooks. There's no proper recording of their transactions. They get a piece of paper. So I think that problem has not gone away, and maybe this kind of push for banking in this crazy way also created a lot of vulnerability in the system. Yeah, I think I'll stop with that.
Yeah, thank you very much. I forgot to say, yes, I was mentioning account ownership, and I was not assuming it's the perfect indicator. It's a very narrow proxy of financial inclusion. And many other aspects, awareness, and financial literacy,
basic literacy
that may explain an actual process of financial inclusion are missing or are jeopardized by the system. No, thank you very much. Thank you very much, Reetika. If there are more questions,
a different perspective, because mine is more management and business perspective. So I was curious of, in Europe, do you think that multinational companies, normally they play a role in agriculture, and they can play a role also because they are called for sustainability, so they have to also introduce sustainability issues in their reports, and they do this, that they have to respect and protect the local communities, and in Europe, they can play a role to protect these rural communities in trying to improve or reduce this dark side of
Again, this is not something that I work on much, but I think by and large companies in India, there are some with good social values and commitment to all kinds of things, but mostly I think they're committed to their profits. So I'm sure there are good initiatives, but whether they can be scaled up and whether they can be a solution to the sharks or vultures who are trying to extract more and more, it's hard to say, because like I said, I haven't worked on it. I still feel that at least based on the experience we have had, say, with the public distribution system, I think one of the biggest reasons why corruption came down so dramatically, or well, not so dramatically, but at least substantially, is because in the past 15 years, people have learned what their entitlements are. And because they are able to assert themselves a little bit, because literacy rates have gone up. So I think the best protection for people is to give them the solid foundation in terms of good health and good education, and then they will learn to fly on their own. in the Indian case, we still spend too little on providing quality education, and we still don't have a universal literacy. Can you believe it? This is the 21st century, and it's like 85% literacy in the country. So of course it's been a big improvement over the past 30, 40 years. There's been huge gains, but still, I mean, in 21st century, to not be able to guarantee 100% literacy, that's a big failing of Indian democracy in a certain sense. And I think that is the longer term solution, because then those people will be able to use digital technologies the same way that I do, to enhance my participation and the gains from everything. Yeah.
Okay. If there are no other questions, I say again, thank you very much, Professor Khera, Reetika. It was really an honor for us to host you here at Unimarconi. I hope this is just the start of a cooperation with the Unimarconi community, with the Indian Institute of Technology in Delhi, and all the interested colleagues and students. Thank you very much. The webinar, the seminar ends here. Thank you.